have a pocket of fat under each armpit that developed during pregnancy and has stayed. I'm back to my pre-pregnancy healthy weight. However, pockets of fat have stayed. I've inquired with 2 cosmetic surgeons, but both have said they can't help. I did leak milk from one of the pockets of fat during pregnancy, so I'm not sure if that's complicating things. I'm surprised that you've seen plastic surgeons who say they can't help, Holly, because that sounds very much like what we would call accessory breast tissue, pockets of fat underneath your armpits. And I would have thought most plastic surgeons would kind of be okay with that. Mind you, you said 2 cosmetic surgeons. Were they plastic surgeons, Holly? Were they specialists in breast? Hey, never accept a lift from strangers. How to find the best plastic surgeon for your cosmetic breast surgery. Written a book about it. So yeah, certainly from what you described. I mean, it's difficult on this sort of stuff because you're kind of like, you're just doing it, by over the ether. So if you've actually seen a surgeon, then maybe that's got more weight than what I'm going to say. But what I would say is what it sounds like is accessory breast tissue. It's unlikely the leaking milk. So has it got a nipple on it? Did the milk come from a nipple? But either way, they can be removed is the answer, and usually they are just fat, as you say. And the 2 options for treatment are liposuction or excision. If you're leaking milk from it, that suggests there's some breast tissue in there. Breast tissue is a bit firmer than fatty tissue, and so it doesn't come out with liposuction. So that would be like a mark against liposuction. The mark for liposuction is the scarring is a lot less than when you do excision. When you do excision, you actually literally make a scar, which can be visible. Whereas liposuction, there's no visible scarring. We sort of hide it in the armpit, and there's usually little stab incisions. The other issue with liposuction is the potential for the skin to be left. So it depends on how big they are and how much they've stretched the skin as to whether liposuction would be sufficient, because liposuction would just remove the tissue underneath the skin and it wouldn't remove skin. So it might be there'd be some redundant skin there. So again, there's kind of pros and cons of liposuction and excision, and it kind of needs a discussion. But the thing you're describing is something that I think that there would be plastic surgeons out there who would be familiar with it. And it sounds like, as I say, accessory breast tissue is what we would call it, and it is not it's not that unusual, Holly. It's something you do see. I've certainly treated a couple of people in the last 6 months or so, although I'm not doing people anymore, not seeing new patients myself, but certainly in the last year probably that's treated 2 or 3. So it's not that common, but it's not that uncommon. Assuming that's what it is, Holly, because I might see it and think, oh crikey, that's something completely different, or I don't know what that is or something, but sounds like